Mr. Smith, are we in any pain today? Let's do this. On a 0 to 10 scale, I want you to tell me where your pain is at. 0 meaning no pain at all, and then 10 being the most pain you've ever experienced in your life. Maybe like during childbirth.
This is a numeric rating scale for pain intensity. These scales have been the standard in medicine for measuring pain for decades. This tool was developed to help medical providers better understand a patient's pain intensity level and the changes that occur after treatments, like medications. You see, pain is a subjective experience. That means each person experiences pain differently. The numbers on this scale allow patients to express the level of their pain. For years, the focus has been on pain intensity, with the objective for both healthcare providers and patients being to get the pain to 0. And while it might be easy to define what 0 is, no pain at all, it's often harder to define the other levels of pain. Is a 4 today the same as a 4 a week later? How can healthcare providers assess improvements in pain over time? Should reaching 0 be the ultimate objective? Healthcare providers have begun to realize that focusing on pain intensity alone might not provide all of the important information. Experts have also started to understand that getting to 0 is frequently not the most important objective, that addressing physical function and emotional well-being is also essential to getting patients back to active and productive lives. The numeric rating scale has been an extremely useful tool as a starting point, a first step, but it doesn't always lead to a deeper understanding of a person's pain, and it doesn't integrate other parts of a person's life, the emotional effects, the physical effects that may be contributing to the way a person experiences pain. Many clinicians began to consider that there might be a need for an improved tool to begin the conversation about pain. So, in 2010, the Departments of Defense and Veterans Affairs partnered on the Pain Management Task Force to examine pain management practices. One of the task force's findings was a general dissatisfaction among both providers and patients regarding the numeric pain rating scale's inability to tell the whole pain story. They noted that providers could often be successful in getting a patient's pain level to 0 intensity, but frequently with an unintentional decrease in function and quality of life. Perhaps chasing 0 pain intensity was not the best strategy. These observations resulted in the development of this. The Defense and Veterans Pain Rating Scale, or DVPRS. It's the numeric rating scale enhanced. The DVPRS builds on the success of the numeric rating scale, but moves beyond focusing only on intensity. When developing the DVPRS, the experts wanted to incorporate aspects from the validated pain scales in use today. At its foundation, the DVPRS begins with the familiar 0 to 10 method of reporting pain. The DVPRS also incorporates multiple other visual cues, including graduated intensity bars, the green-yellow-red color continuum, and a facial pain scale for those who might have difficulty communicating. Additionally, the use of mild, moderate, and severe pain levels correspond to the pain intensity colors and bars. When using the DVPRS, the conversation still begins with the patient communicating their pain level using the available cues on the 0 to 10 scale. But what's important about the Defense and Veterans Pain Rating Scale is that the conversation doesn't stop there. The DVPRS moves far beyond pain intensity. Perhaps the single most important evolution on the DVPRS is the addition of functional language associated with the 0 to 10 numbers, anchoring the patient's experience of pain in terms of its level of functional disturbance. With the inclusion of these anchors, 2 things are accomplished. First, as both patients and providers become familiar with these functional anchors, the pain question has a greater clinical value, becomes easier to administer, and the recorded pain values will have greater meaning. Also, by recalibrating the pain discussion from intensity alone to one that emphasizes the patient's function, patients and clinicians can now discuss pain and measure success of pain management in the context of what is improving function, thus affecting the cultural change needed to decrease medication-centric pain management aimed solely at getting the pain to 0.
Mr. Smith.
Yeah.
How are we feeling today?
A little uncomfortable.
Okay, well, we'll do our best to get you feeling a little bit better. This is the DVPRS. It's a scale we're using to improve my assessment, improve our discussion about your pain. It'll allow both of us to better understand how pain is affecting your life. It'll also provide me with more information to help you return to the activities you enjoy. Now, using the DVPRS 0 to 10 scale, paying close attention to the words connected to each number, how would you rate your pain today?
6. Hard to ignore and avoid usual activities. Yeah, that sounds right.
All of these DVPRS elements together help standardize communication between healthcare providers, as well as during patient-provider discussions. But that's not all.
You say your pain is a 6 on the DVPRS scale?
Yes, that's right.
Okay, I'd just like to ask you a few more questions in order to fully understand how your pain is affecting other areas of your life. So let's just turn that over real quick.
Sounds good.
Okay, so during the last 24 hours, describe how pain has interfered with your usual activities.
Because pain often transcends a simple measurement of intensity and frequently affects many areas of a person's life, the DVPRS also includes supplemental questions aimed at providing insight on the impact of pain on 4 key areas: activity, sleep, mood, and stress. These supplemental questions take only a few extra seconds to administer, but provide additional indicators of the success or failure of pain management therapies far beyond what is obvious when only looking at pain intensity. It is not uncommon for many pain patients to remain relatively static in their pain intensity score for a period of time. However, changes can be demonstrated in other measures that indicate improvement in a patient's quality of life. Assessing these other dimensions of pain is critical to the provider's understanding of how pain might be affecting the patient's overall well-being and can alert to potential physical and psychosocial issues related to pain.
Okay, great, Mr. Smith. I now have a better understanding of your pain. So we just need to finish up your exam and then maybe discuss a few things like how to improve your sleep, how to get you back out there and moving around again. Also, these things should help with your pain.
Thanks, Doc.
The DVPRS should be used whenever pain is discussed or assessed. The few extra seconds it takes to use the DVPRS provides valuable information and insight for both the healthcare team and the patient, as they work together to determine appropriate treatment plans for managing pain, keeping an emphasis on maximizing function as well as restoring or maintaining quality of life.